Every 45 seconds, someone in this country has a stroke. By the time this program is over, 40 people will have suffered a stroke. Most of them won't feel a thing, but in a split second, their life changes forever.
I felt funny, but not painfully.
I don't know what's going on, but I honestly feel like I have the worst headache of my life.
When I had a stroke, I didn't hurt at all.
It's like I'm a different person, and I can't do things like I used to do.
A stroke is generally considered to be something that is a sudden onset of a neurologic deficit. For instance, you suddenly drop with paralysis on one side of your body or loss of sensation on one side of your body or the other. The stroke can be generally classified in two different categories, hemorrhagic and ischemic. Hemorrhagic being when there's been a blood vessel in some way ruptured and there's been bleeding into the brain. Ischemic being when there's been a blood vessel that's gotten plugged up or occluded, and then some part of the brain loses blood supply and therefore stops functioning, and that's what produces the deficit. The brain is organized in two hemispheres, the right hemisphere and the left hemisphere. In the left hemisphere, there's a particularly important area around the separation between the frontal lobe and the temporal lobe, and that's called the Sylvian Fissure. And the part of the brain around the Sylvian Fissure is very functional in language, in both understanding language and then producing speech. And the connections go from one part of the brain to another part of the brain to produce the speech output from the language understanding area. And when there's an interruption in that, or a stroke or some other abnormality that interrupts signals from those parts of the brain, that's called aphasia.
Aphasia is a language disorder, and it is a language disorder that is a very frequent accompaniment of stroke. Stroke is the major cause of aphasia. Aphasia often also involves difficulty in understanding what other people are saying, with changes in the ability to read and to write. So it's much more encompassing than just a disorder of speech. It's a disorder of language.
Before her stroke, Judy worked at the largest public library in Dallas. She took care of the staff, typed reports, made phone calls, and helped staff members meet deadlines. At home, along with her husband Bill, she raised 3 children. She lived an active and independent life.
After the stroke, I felt like my brain set down because I didn't talk. I knew that I was thinking of the right thing to say, but I couldn't say that. I didn't realize how hard it was. It was devastating.
Don, a career journalist and author of One Man's Journey, was a machine gunner during World War II. He was wounded and subsequently captured.
I was in combat, and I was a prisoner of war. I had a stroke with aphasia, and I had a heart attack. But the aphasia left me no choice but to speak haltingly.
Don compares his aphasia to his war experiences.
When I was wounded, I got over the wound, but I never get over the aphasia because the aphasia will last me the rest of my life.
According to the National Aphasia Association, over 1 million people in our country have aphasia, but it's certainly not a household name. Why is that? I suppose it's because we have a tendency to lump all of the communication problems that result from stroke under one heading. We call them speech problems. You know, aphasia embraces far more than that. It includes our ability to use verbal language, yeah, but also our ability to understand the language of other people, to read, and to write. A much more encompassing problem.
At 21, Sarah was a pre-law student at Pepperdine University in California. While having dinner with friends, she felt a sudden, piercing pain in her head. She would soon be diagnosed with a ruptured arteriovenous malformation. The result? Aphasia.
The only way I can really describe aphasia is it's that feeling when something's on the tip of your tongue and you just don't know how to say it. It's like that every day of my life. Like, I can't even explain how upsetting it can be to know that you could have explained something before so well and so precisely, and now you're just kind of a victim to these words that are it's so imperative to express what you want to say precisely, and you just can't do it.
For those with aphasia, it's often easier to just avoid people rather than attempting to communicate.
The people don't understand aphasia. I tell them I had a stroke, and I can't talk plainly at all, but ordinary people don't understand what aphasia is.
Communication is our way of getting along in the world. And when someone has aphasia, what happens is that their ability to share feelings and emotions and thoughts with other people are all seriously diminished.
I don't go to church because of the aphasia. People will try to come and welcome me, and I don't know what to say.
Aphasia makes me feel isolated because I don't want to talk to another person who is not understanding. I don't want to be alone.
As you observe the struggle that they're going through, you feel a hurt. You feel a pain because you watch, like I watch Judy, and she's sitting there, and in certain places it's like you're starting all over again, learning to speak, learning to talk, learning to go through that. And you kind of agonize with her.
People who have aphasia, their families and professionals have definite ideas about what the public should know about this problem.
The most important thing that people really need to know is that aphasia doesn't go away. You have it for the rest of your life. You deal with it every day, and I'll continue to deal with it until the day I die.
People need to understand that they need to take a little more time and allow the person time to think, time to talk. It's like I always tell when Howard and I first started dealing with Sarah, he would talk loud. And I'm like, Howard, she's not hard of hearing, she's aphasic. You know, it really, it doesn't have anything to do with her hearing. She understands what you're saying. Yelling or talking more loudly isn't going to make her understand.
It's important to know that aphasia isn't a disorder of cognition, that one is not necessarily suffering from changes in the ability to think. Much more, it's the ability to put those thoughts into action as language and communication.
I have a mind that's good, but it's not talking very well.
Give them enough time to get their message out. And there's probably nothing more important than conveying an attitude of compassionate listening and making sure that part of that active, compassionate listening is also trying to find out from the person with the aphasia what things he or she thinks they could do to make it easier for facilitating communication.
People need to have patience to let me talk.
Be patient. Be understanding. And let us talk. We don't talk right, but we understand what we needed to say.
Aphasia affects the entire family. The dynamics of communication change. These changes can become obstacles, but often provide opportunities for people to grow closer to one another.
Families have their own problems that result from this condition. Families often have change of status in terms of somebody, the family member who is the breadwinner is no longer the breadwinner. Roles change and responsibilities change. So there are a lot of problems that are not just the person with the aphasia, but are the problems of families too. So for me, both for families and for the person who's had the stroke, the take-home message is don't give up. Don't give up.
I think I get fearful, then I get angry, and then I raise my voice too much, and I fuss and fume and carry on, and then I have to turn around and say, I apologize, and I keep trying to tell her, don't take it personally.
It's been hard on me, Bill, because it's frustrating for him, and it's not good for him. He doesn't understand me a whole lot, but he's good.
Now that I understand that Sarah has aphasia, the communication difficulty, I've learned several things. One is I can't interrupt her because that breaks their train of thought and it's difficult for them to remember what they were saying. The other thing is that if we're in a group setting, she can only deal with one person talking at a time. And the third thing is that you have to be very specific in your instructions when talking to her. They cannot put pieces like a puzzle together sometimes.
Howard talks about his feelings when first hearing about his daughter's stroke.
Almost like the world was coming to an end. You assume you're going to predecease your child, and you realize how fragile and important life is. And to a parent, to a normal parent, your child is the most important thing in your life.
Don was married to his wife Carlene for 58 years. He describes her as a wonderful woman who remained compassionate and a great strength to him.
I expect her to walk in any minute. I buried her at the National Cemetery. Sometimes I go to the cemetery just to sit and think and think about old times. She was my wife for 58 years. She drove me everywhere after the stroke.
During the initial stages of recovery, most folks with aphasia are enrolled in individual speech-language therapy programs. It's here that we begin to craft strategies that will facilitate the communication skills of people who have difficulties reading, writing, understanding other people, and using their verbal language. And it's here that we begin to try to address rehabilitation in a very positive light. Does individual speech-language therapy help? Yes. Does communication improve year after year after year? Yes, it does.
I've got better little by little by little by little by little.
It's a long way, but I'm getting better.
Judy's speech therapy was filmed from the beginning by her speech-language pathologist.
Today, May 24th.
While her progress in these early weeks was dramatic, years later she continues to improve through group interactions. During these weekly sessions with your groups, patients have found comfort, understanding, and hope.
The power of aphasia groups is really probably the big news in aphasia rehabilitation of the past 15, 20 years. The best thing that can happen is for aphasic people to have groups and then some individual therapy, but they're the centerpiece for me. And the psychosocial concerns and the camaraderie and the getting together and the joint problem solving, all of that stuff is really, a marvelous change and a marvelous development.
The aphasia groups, we talk to each other, and I don't talk very much when I get away from the aphasia group. But in the aphasia group, I feel comfortable and I talk.
The aphasia group meant a world to me, and I couldn't have existed without the aphasia group.
The aphasia group has been real helpful in the fact that it gives you kind of a dynamic with other people that are struggling, oftentimes with more severe physical conditions than what Judy was dealing with. And there was a fellowship that developed out of that the members became family.
I believe that people probably are more rather than less resilient, and that optimism is a much more prevalent way of dealing with problems than pessimistically. And somehow or other, for many people who have aphasia, and this is families as well as the people themselves who have aphasia, it's kind of a clarion call to figuring out how to get around this terrifically difficult problem. I think never giving up and learning to be hopeful would be the take-home message that I would like to leave with people.
The understanding that you and I can bring to people with aphasia may well help enhance their lives as successful communicators.